Hello everyone. Today we're going to discuss the differences between instructional goals and learning outcomes with regards to EMS education. EMS education presents a unique set of opportunities for our students. We want to teach them as much as we can about the human body and how to fix ailments of the human body in a very short amount of time. We know that most EMS education courses vary between 6 months to 2 years, EMT programs being the 6-month version and paramedic being somewhere between 1 year to 2 years depending on the type of course. So it's a lot of information to cover in a very short amount of time. With regards to instructional goals are things that as an instructor I have to portray to my students. I have to teach them a certain set of skills or practical knowledge, and I have to cover that information that's given in the textbook in an appropriate manner so that they understand that as well as they can. Learning outcomes are what we hope our students take home at the end of the day. I can relate this back to congestive heart failure. Our instructional goals of congestive heart failure is to teach the anatomy and pathophysiology and the reasons why this happens and how to treat congestive heart failure, where our learning outcomes kind of delves into the more practical understanding of our students. This is what we want our students to take home. When they go out into the field and treat patients with congestive heart failure, these are the things we hope they remember and they've learned throughout the course and their time with them as students. So with congestive heart failure, the approach that I've taken recently is teaching congestive heart failure in the cardiovascular system as a whole with regards to plumbing. We know that, and most students know that, plumbing involves two types of equipment, if you will. You have a pump of some sort, and then pipes that get that water through our house and ultimately to our sinks and whatnot. And so I've taken that approach and explained congestive heart failure to them, and it's been very effective recently. And I've said that you have a pump problem with the heart, and that problem causes a backup of fluid. So I have presented to them right-sided heart failure, and so if you have right-sided heart failure, where do you think that backup is going to occur? And they most often have correctly stated that that backup is going to occur in the legs, and we discuss pedal edema and we discuss treatment options and things like that. But I think that solidified their understanding of congestive heart failure, and we also conversely talked about left-sided heart failure and where that fluid is going to accumulate, and we presented it in a manner of tracing a drop of blood through the heart initially, so that they understand how the system is supposed to work. Under normal operating procedures, they know how a drop of blood is to go through the heart. And by knowing the knowledge of how it's supposed to work, they can more quickly and readily identify when it is not working and how to treat accordingly. The overall goal of an EMS program, whether it be EMT or paramedic program, is to allow our students to think critically. We want our students to take the knowledge they understand and present it to a patient that may not present themselves in a textbook manner. We know that, unfortunately, patients don't always present the way we would like them to and the way that the textbook says they're going to, so we need to teach our students to think outside the box a little bit. One of the ways that I have done that recently is through utilizing a student-centered approach. We want our students to be the focus of the class, and we want them to have the ability to effectively participate in the class, and we want to shy away from a instructor such as myself standing in front of the course or in front of the class and presenting the course in a manner of me talking to them versus them talking to themselves. What I like to do is group discussions. So I like to present a topic, not necessarily give them the answers to the questions that I'm asking them, but instead allow them to debate and have constructive criticism and constructive discussions about how they think it's going to play out. So again, back to the congestive heart failure scenario. This is congestive heart failure. This is the problem, and we present all of those instructional goals to the students, but then we let them develop their own learning outcomes. A lot of times what I have realized, excuse me, is that students may articulate a certain way of thinking, and through group discussions and through constructive criticism of the other students, they realize that maybe they weren't on the right track to begin with, and that solidifies their understanding. So they may start out with an opinion that is not accurate and not medically factual. After these discussions are completed, they understand that maybe my way of thinking wasn't appropriate and wasn't the correct appropriate treatment or understanding of the knowledge, things like that. So we really want to keep the student at the focus of the class. We want to try to shy away from lectures. Lectures have their place, certainly, and they're very important, especially in the EMS settings. There are instructional goals that we have to give to our students, and we have to meet these certain objectives that are presented most often in the beginning of a chapter, and certainly throughout the duration of their respective courses. But more so, we want to focus on their learning outcomes. What are they taking home? What knowledge are they understanding about what we are teaching them? And I think that's a much more effective way to look at education as a whole, and especially as EMS education. We wanted to ensure that we are putting EMS providers in the field who think critically, who are able to problem solve, and who are able to accept advice and criticism from their comrades, from their supervisors, from their other employees that they are working with, and decipher that and ensure that it is accurate knowledge, and if it is in fact accurate knowledge, take that advice and build upon themselves to become better EMS providers and ultimately take care of patients more effectively. So again, instructional goals, things that we have to present as instructors to our students, and learning outcomes are the concepts that we hope our students are able to retain and hopefully go out into the field and make better EMS providers. So again, thank you for your time, and look forward to seeing you soon. Thanks.